Every day, multi-billion-dollar companies around the world are engineering new and innovative medical technologies that change the face of healthcare. As a result, we often expect that the future of medicine will come from the developed world, in the form of some sophisticated scanner that will instantaneously detect cancer, or rather a revolutionary medication that will cure diabetes for good. Yet despite unbelievable medical advancements and achievement over recent decades, the gap between urban and rural healthcare delivery in Australia continues to widen. Why is this the case? Why should children born in rural areas of Australia expect to live between 3 to 5 years less than children born in major cities like Brisbane or Sydney? Why is the mortality rate in rural areas nearly 1.5 times greater than that in major cities? Perhaps in addition to looking at our high-tech computers and our mice models in the lab, we need to look out of the box for inspiration. Maybe it's time we need to look at rural health from another point of view. For all we know, the next medical breakthrough may already be flying above our heads, high in the sky. We're just yet to look up and realize it. My name is Ari. I grew up in Sydney, finished high school in Barcelona, and then graduated from medical school at James Cook University last year in North Queensland. Despite spending the majority of my life living in major cities, I fell in love with the laid-back atmosphere and outdoor lifestyle the far north had to offer. So I decided to begin my career at Cairns Hospital, a decision that opened the door for me to win the Queensland Junior Doctor of the Year award only a few weeks ago. Our local regional health service encompasses over 30 varying sized medical facilities and serves a population of 250,000 across an area of 142,000 square kilometres. That's nearly the equivalent size of Belgium, Denmark, Switzerland, and the Netherlands all put together. Understandably, this immense landscape leads to both healthcare and logistical challenges inconceivable for people living in major cities. As part of my internship this year, I had the opportunity to work in one of these smaller rural hospitals, about an hour's drive away from Cairns. And to be honest, I was really excited. I was full of energy, full of enthusiasm. This was my chance to shine. I was finally going to be able to put all of my knowledge into practice. But what I quickly came to realize was that people living in rural communities are significantly disadvantaged due to geographical confines outside of our control. Not only do they have limited access to health services and medical professionals, in fact, in some places they can barely even get to a GP appointment within 2 weeks, but they also have poorer health behaviours and a lower socioeconomic status when compared to their city counterparts. The reality is that these factors contribute to 5 times the risk of death from motor vehicle accidents, 3 times the risk of death from diabetes, and double the risk of death from suicide when compared to those living in major cities. When you take these into account, it becomes pretty easy to see how people living in rural communities endure a vastly lower life expectancy just by simply being born in these areas. These are terrifying statistics when you consider that 1/3 of the entire Australian population lives outside of metropolitan areas. But this is the landscape of rural health today. Whilst on placement, I witnessed firsthand the stark reality of these numbers come to life. I saw a snakebite victim have to leave his young family behind in order to be transferred to Cairns, as we simply didn't have the sufficient resources to manage his condition. I saw an unwell teenager with appendicitis have to wait several hours for an ambulance to arrive, as all of the other officers on duty were transporting patients of their own. I also saw a helicopter retrieve a middle-aged lady involved in a horrific motor vehicle accident in the early hours of the morning, a sight and sound I will never forget. You see, coming through medical school, you spend countless hours examining the cadavers and reading countless pages from the textbook just so you can be prepared to be the best doctor you can to solve medical problems. I learned how to take a thorough history, how to examine the patient, and order the investigations that I needed with the intention of prescribing the treatments that my patients required. I was also informed of the logistical challenges met by rural practitioners on a daily basis, but it was only through living, breathing, and working in this environment that it became real. What I was not taught at medical school was how to manage my patient when the exact investigation or treatment that I needed was not available at my disposal. Or how to care for my patient when the time-critical intervention was hundreds of kilometers away. These problems are real. They are complex, not easy to fix, but ultimately cost lives. Working in this environment enabled me to recognize that rural medicine is just as much about the practicalities and the logistics of patient care as it is about clinical acumen. And the hospital that I worked at is not unique. You see, many of the problems that we faced are experienced in all of the other regional centres around the remote areas that we live in, and in fact, for that matter, around the country. Now, don't get me wrong, I'm by no means here to restructure the entire Australian healthcare system, but what if we could improve one little, well actually when you think about it, one pretty large part intrinsically linked to rural health, the tyranny of distance. You see, traditionally, we've looked to the developed world for healthcare solutions, as this is not only where the political and the financial powers exist, but often where the human resources are found. What if we strayed from this norm and instead looked to the developing world, where the exact issues of geographical isolation, poor infrastructure, and environmental constraints impact on healthcare on a daily basis? This question deeply intrigued me, and being the curious person I am, I started looking into alternate methods of delivering healthcare solutions. In doing so, I came across a hero without a cape in the name of Keller Ronaldo. Now, for those who have not heard of or are not aware of Keller, I highly suggest you look him up because he is partly the reason for this talk. His company, called Zipline, deploys autonomous medical drones to deliver life-saving blood products to remote medical centres in Rwanda and Ghana in Africa, of all places. I mean, how cool is that? He instilled in me the belief that anything can be done if you tackle the problem with the right perspective, for the right context, with the right intention. So, after watching his TED Talk and picking my jaw off the ground in awe, I started to consider and even believe that if places like Africa can put in place measures to resolve logistical healthcare issues via the sky, then why can't we do the same right here in Australia? This question added fuel to my desire to learn more about medical drones, and my research into them skyrocketed as I learnt of multiple other settings within the developing world where they were being used with great success. For example, in Vanuatu, earlier this year, drones were responsible for delivering the first vaccine used to immunize a child, a historic first for the world, born out of the Pacific Islands. Likewise, in Papua New Guinea, our closest northern neighbouring country, drones are currently being used to fight tuberculosis, as they can transport urgent blood samples and sputum cultures from the remote medical centres to the regional district hospital without delay. This, in turn, facilitates the delivery of treatment regimens back to the remote medical centres, such that patients can be treated much quicker. The list goes on, but what is remarkable is that these applications are creating genuine hope for a better future in these countries. Why can't we do the same in rural Australia? Now, I must admit, I'm by no means a drone expert, nor am I a politician, nor an engineer, nor a telecommunication officer to design and implement the perfect aerial approach. But I am a genuine advocate for my patients, and I do see a great need for this technology to vastly improve the lives of those in our own backyard. I'm also acutely aware of the strict yet understandably sensible rules for personal drone use. But surely in this day and age, we can collaborate with government bodies and civil aviation authorities to create medical drone rules that would vastly improve the delivery of healthcare in rural communities. Just think of the end product. Imagine what life would look like if drones became core components of the fleet of emergency medical vehicles. We could bring the health service to the patient rather than the patient to the health service. Drones could transport time-critical HIV medications or expensive rabies vaccines up into the Cape. Alternatively, they could deliver external defibrillators or specific connection pieces for specialized equipment out into remote parts of the Torres Strait. We could even mimic Keller's idea and use drones to deliver life-saving blood products to women suffering from significant bleeds during childbirth in small Aboriginal medical centres. This could all be done via the highway in the sky in half the time it takes by road. And not only would we be saving on time, but it would significantly reduce the costs associated with fuel, waste, and precious human resources. More importantly, it would potentially avoid the need to transfer the patient to the nearest referral centre, often hundreds of kilometres away, and allow them to be treated closer to their community. In a different light altogether, drones can also provide a set of eyes in addition to a pair of hands. Consider this scenario. An ambulance containing a drone arrives at your best friend's motor vehicle accident in the bush. Within seconds, they are resuscitated by the paramedics. Within minutes, their bloods are taken, loaded into the specialized temperature-monitored compartment within the drone, and are airborne en route to the receiving facility via geolocation. Throughout this situation, the drone could provide high-definition vision of the crash site that could be transmitted to emergency services to allocate resources. And the same footage could also be provided to emergency medicine specialists that could assist the paramedic at the scene if needed. Then, by the time the victim arrives at the receiving hospital, the clinician has already arranged the blood transfusion if needed and has viewed all of the results he or she needs to save their life. This is my idea of patient-centered care in the bush. The recurring theme in all this is that time is life, and ultimately, it is the saving of time that could be the difference between life or death. Drones are just one example of a technology currently being used in the developing world that we here in Australia are yet to implement. I have no doubt medical drone technology will arrive on our doorsteps in the very near future. The technology is already here, it's inevitable. But it just makes you think, what else are we missing? What other solutions can we gain from the developing world? Now, I'm not here to say we need to look to the developing world for all of our healthcare needs. Of course not. These places have other healthcare challenges that we cannot even comprehend. But what I am saying is that we need to be open to learning and challenge the status quo by seeking inspiration from places where we least expect, where some of the resources may be poorer than our own, and where individuals have no other choice but to get creative. I recently came across this quote by the late Dr. Wayne Dyer, an internationally renowned author and a motivational speaker, who said, "When you change the way you look at things, the things you look at change." And I think this sums it up beautifully. Only with this awareness will we be able to see rural health from another point of view. So I implore you to rid your mind of medicine as the four-walled consultation room and look up. Look out of the box, for it may be a drone or some other healthcare solution we are yet to conceive that saves your life in the future. Thank you.